This is the story of a health system deliberately sabotaged by the Zionist state and its army. Doctors, nurses, hospitals besieged since 2006. A story of Healthocide. Before October 7th, 2023, a fragile but functioning system. Before October 7th, 2023, Gaza's health sector was fragile but functioning. Despite years of blockade and poverty, it achieved remarkable milestones. UNRWA operated 22 primary healthcare centers, staffed by over 1,000 specialists, providing comprehensive care, including maternal health, chronic disease management, and mental health support. Over 3.5 million consultations annually, with 100% vaccination coverage. Hospitals like Al-Shifa and Kamal Adwan served as lifelines, treating thousands despite shortages. Gaza's health system was strained, but it was resilient until the war began. Complete collapse by 2025. By late 2025, Israel had destroyed most of Gaza's health sector. The United Nations reported that the Israeli army carried out 735 attacks on healthcare facilities between October 2023 and June 2025. 34 hospitals were severely damaged or completely destroyed by Zionist bombardment, leaving only 16 out of 36 hospitals partially functioning. Due to Zionist aggression, bed capacity dropped to 1,822, far below the needs of a population facing massive human losses. Medical students now serve as frontline doctors, filling the void left by slain or imprisoned professionals. Through bombardment and destruction, the Zionist entity has systematically dismantled Gaza's health system. Hospitals destroyed. Zionist war machines turned hospitals into battlefields. IDF brutally and inhumanely bombed at least 27 hospitals directly, deliberately destroying surgical units, laboratories, and entire emergency departments. IDF bombed Kamal Adwan Hospital, the last functioning facility in northern Gaza, assaulting and setting it ablaze. Al-Awda Hospital was shut down after repeated IDF attacks on Jabalia. These were not mere buildings, but safe havens for thousands of displaced civilians, denied to them by the Zionist entity. IDF targets doctors. Doctors became targets of the IDF. IDF killed more than 1,050 medical workers. The IDF killed senior doctors such as Dr. Mahmoud Abu Njela of Al-Awda Hospital in airstrikes. The Zionists also arrested other doctors during raids, accusing them without evidence of aiding fighters. The IDF silenced Gaza's healers, leaving the wounds of the injured and sick untreated, targeting medical teams. The hand of Zionist destruction extended beyond doctors. IDF killed more than 1,700 healthcare workers, including nurses, paramedics, and ambulance drivers, according to Al Jazeera. Zionists also killed many while evacuating patients or delivering aid. Palestinian families grieved not only the loss of loved ones, but also the collapse of the system that sustained life. Imprisonment and suffering. The Zionist entity did not stop at killing hundreds of medical workers in Gaza, but also hid hundreds more in Israeli prisons. Zionist entity has killed at least 400 detainees since October 2023, while 95 remain imprisoned as of late 2025, according to The Intercept. Among them was Dr. Hussam Abu Safia, director of Kamal Adwan Hospital, who was arrested by the IDF and held without charge. The Intercept reported testimonies documenting torture, starvation, and denial of legal rights inflicted on Abu Safia by the Zionist entity. The Zionist state killed some detainees in custody, leaving their families without answers. Israel's judicial system turned doctors and nurses, protected under international law, into prisoners of war crimes. Message of defiance. The IDF's assault on Gaza's health system is deliberate, not collateral. The IDF destroyed hospitals, killed doctors, and imprisoned nurses. Yet survivors resist and testify. As one slain doctor wrote on a hospital whiteboard, "Whoever stays until the end will tell the story. Remember us."